Hi, I'm Sandra Marks, a practicing Bowen therapist and a member of the Bowen Therapists European Register, the UK's largest accrediting body for practicing Bowen therapists. I'm here today to talk to you about the Bowen therapy, also known as the Bowen technique. I'm going to tell you about what it is, how it works, and about the wide range of conditions it can help treat. The Bowen therapy is a very gentle, non-invasive treatment which developed in Australia and came to the UK in the early 1990s. It is a very versatile therapy which can bring relief to people with a range of problems. Problems which may have affected them for years, often where conventional treatments have failed to help. It can help with conditions such as neck and shoulder pain, frozen shoulder, headaches, migraine, asthma and hay fever, tennis elbow, IBS, chronic back pain, hip pain, knee, ankle and joint pain, and even fertility problems. It can also play a major role in alleviating the symptoms of stress. Bowen is safe and suitable for people of all ages, including newborn babies and the very elderly. It is also an excellent healing tool for pre- and postnatal and pre- and post-operative periods. The therapy treats the whole person and not just the presenting symptoms. A Bowen treatment normally lasts between 45 minutes to an hour. We recommend that whilst one treatment can certainly help, a course of 3 treatments spread over a month will enable Bowen to produce the maximum benefit required. Some of our patients don't need to return after the first course of treatment, but many like to have what they call a maintenance treatment, once every month or so. You might like to call it an MOT, which helps maintain the state of well-being. Before the first treatment, the therapist will talk to the client for a while to help understand the problems that are being experienced and will make detailed notes. These are updated after every session to keep track of the effectiveness of the treatment. Treatment is very simple. Apart from wearing loose clothing, the client doesn't need to prepare in any other way. How does it work? Well, the Bowen therapy involves the practitioner using only thumbs and fingers, making gentle rolling movements over muscles, ligaments and tendons at precise points along the body. It reacts with the autonomic nervous system, which controls 80% of our bodily functions. When a muscle is challenged with a Bowen move, it sends an impulse or message to the brain. There is a rest period between moves, facilitating the interpretation of the impulse, and the brain will send a response back to the point of origin to initiate a change. The process releases energy and encourages the body's own healing systems. Bowen must not be confused with massage, as it does not involve continuous moves. It is a series of moves designed to bring the body back into alignment as a whole. And there we have 2 nice level legs. We do the same treatment for all conditions, rather than just 2 or 3 moves to address a specific problem. But within a set of moves, there are specific ones to help with specific problems. For example, this move helps with back pain. This move helps with migraine. This move helps with asthma. Bowen is recognised as a complementary therapy. Unfortunately, it is a fact that there are therapists who practice with a minimum amount of training and qualifications, and it is those individuals who can give complementary therapy a bad reputation. The Bowen Therapists European Register works to remove any such doubts. Bowen therapists are only allowed to join the register if they can prove that they have achieved specific qualifications and are committed to a programme of continued training. All registered therapists must be qualified in Bowen therapy and anatomy and physiology to diploma level and to have a current first aid certificate. In addition, they must also attend annual professional development courses to build on their skills. bter also provides members and their clients with a code of ethics and practice. It is therefore important for anyone considering a bowen treatment to initially make sure that the therapist is a member of a register. The bter website gives details of all its members, so it's easy to double check. In addition, it provides a lot more information about the therapy, how it can help, and testimonials from people who it has helped. If you would like to locate a therapist in your area, the site also has a Find a Therapist facility. I hope that you have found the information in this presentation useful. This therapy is truly remarkable. Just by using fingers and thumbs to challenge the muscles and soft tissue, the therapist can achieve life-changing results. If you, a family member or a friend are in pain and suffering, you can put a stop to it today. A course of bowen therapy is a serious option and one worth your consideration. It could truly help you live your life to the full once more. It did with me. So don't put it off. Make that life-changing decision now and regain control.